This segment is sponsored by Reston Hospital. At Reston Hospital Center, their team of obstetricians, nurses, lactation consultants, and more provide personalized care for every labor and delivery experience. And if your baby needs extra support, their Level 3 neonatal intensive care unit, staffed by neonatologists from Children's National Hospital, offers advanced, compassionate care. I spoke with some of the NICU team and learned more about how they take care of any baby in need. Dr. Saeed, thank you for having us. Can you just describe the Women's and Children's Services here at Reston Hospital Center?
Sure. Here at Reston, we've got a high-risk, maternity delivery center where we really aim to provide that high-level quality care in a very personalized and specialized way. We've got perinatal navigator services available for certain high-risk pregnancies where we work real closely with MFMs, with OB groups, and the patient, and then involve other specialties such as neonatology if it's needed.
Could you share how you feel that women's experience, mother's experience, is different here at Reston Hospital Center than it might be somewhere else?
Sure. So we really work on customizing the birth experience for our patient. Reston used to be a small community hospital, which it isn't anymore, but we are in the community and we're close to home. So we work closely. We have a perinatal navigator, we have social work. We really try to talk with our doctors and get to know the patients before they come in the door, and that way we work with them to customize what would be the best experience for each of them.
I think it's somewhat of a boutique experience in the sense that it may not be a massive 100-something bed NICU, at least on our end, but it is 29 beds. The mom's experience here is along with the baby. We get to know you through your entire stay. We partner with you. We want you to be a member of this team, and we want your input at all times. And so it's a very, you become like a family here, especially if you're here 2-3 months with a NICU child. We definitely get to know you. We make little signs for you. We celebrate every tiny milestone and every step back. So it's definitely like you're one of us.
I imagine it's a bit of an anxious time for parents. How do you support those families when their child's here in the NICU?
In the NICU, we give you the same nurse, and so they have a formal relationship with the nurse. We also have social work services, we have case management, we have a perinatal navigator that checks on them. I check in on them every day, so we do try and customize their experience and get to know them extraordinarily well. And we have them come back and visit us. We had a 16-year-old twins came back on their birthday last week. They were born here 16 years ago to come and celebrate their birthday with us. So that was it is really special.
I understand you have a Level 3 NICU here. Can you help us understand exactly what that means?
So our Level 3 NICU takes care of our smallest baby. So from viability, which is ever changing, so 22, 23 weeks, all the way up to full-term babies. We can take care of our sickest and our tiniest. We just don't do surgery.
What would you say you are most proud of your team here at Reston Hospital Center?
I think it is really the family-centered care that we provide. So we really have a large multidisciplinary team here in the NICU that cares for these really small and sick babies, and it's treating each patient and each family as individually as we do that I'm so proud of. The nurses here will take care of these babies as though it was their own family member. We really do aim to provide, again, a patient-centered and family-centered approach, and that means including the family every step of the way.
I spend a ton of time here with these people, this hospital, this family, and I think that's part of what I'm most proud of. I'm also most proud of the way we have taken care of these patients and these families and treated them as part of the care team, and we were able to involve them continually.
I feel it's a family. It's a great teamwork between all the units, and everybody's here to make it the best experience. This can be the best day of your life.
Is there a way that a family can take a tour or take a class and just kind of familiarize themselves more?
Yes, so they can go on the website and they can book tours, and then also through our perinatal navigator, especially if we know a baby's going to be a known NICU admit. She does private tours and is more specialized for each couple.
Register for a tour or maternity classes by going to restonhospitalcenter.com, then classes and events. If you would like to connect with our perinatal nurse navigator, please call 703-639-9538. Again, that's 703-639-9538.